How do you understand your cancer diagnostic report? Imagine opening a letter that holds the key to your health journey. That's what your cancer diagnostic report is, your personal health story written in medical language. It may seem overwhelming at first, but breaking it down can make it easier to grasp. This report is a detailed document that explains what doctors found when they examined tissue samples taken during a biopsy or surgery. It's like a report card for your cancer, showing what type it is, how aggressive it might be, and how far it has spread. Knowing how to read this report helps you understand your diagnosis and what steps come next. The first part of the report usually includes your name, birth date, and the date the tissue was taken. It also describes where in your body the sample was taken from. This ensures everything is specific to you. Next, the report describes how the tissue looked to the naked, called the gross description. It might mention the size of the sample, its shape, color, and texture. Then comes the microscopic description, which is about what the tissue looks like under a microscope. This part details the size and shape of the cells, how they are arranged, and if they look abnormal. The core of the report is the diagnosis. It states whether cancer is present and, if so, what kind it is. For example, it might say carcinoma, lymphoma, or sarcoma. It also notes where the cancer started and how aggressive it might be, which is called the tumor grade. Higher grades mean the cancer cells look very different from normal cells and may grow faster. The report also gives information about the size of the tumor and its location in the tissue. If lymph nodes were examined, the report will tell you if cancer has spread to them. The number of lymph nodes involved can influence treatment options and outlook. The margins section explains whether the tissue removed had cancer cells at the edges. Clear or negative margins mean the tumor was likely fully removed. Positive or involved margins suggest some cancer cells remains, which might mean further treatment is needed. Sometimes, the report includes the stage of the cancer. This describes how far the cancer has spread in your body. It might be determined from the report or through additional tests like scans. Staging helps your healthcare team decide on the best treatment plan. Many reports also include results from special tests called biomarkers. These tests look for specific proteins or genetic changes in the cancer cells. For example, in breast cancer, tests for estrogen receptors, progesterone receptors, and HER to help decide if targeted therapies will work. Finally, the report might have extra comments from the pathologist. These notes can clarify unusual findings or explain what the results mean. Sometimes, new test results are added later as an update. Understanding your diagnostic report is a vital step in managing your cancer. It helps you see the facts about your diagnosis, which your doctors will use to plan your treatment. If anything isn't clear, don't hesitate to ask your doctor or a patient navigator to explain it. Being informed makes you an active participant in your care. Living with cancer can be challenging, but knowing what your report says can make you feel more confident and in control of your journey.